Again that the pandemic is affecting the Black community at a much higher rate. The governor put together a minority task force to look at the issue. And as News 5's Amanda Van Allen tells us now, their preliminary results are in.
The data and history is clear. Black people are being diagnosed with the coronavirus more than their white counterparts, just as they have so many other diseases.
Now, health disparities did not occur overnight. They are complex and present complex challenges. The current coronavirus pandemic has brought into high contrast these troubling issues.
Governor DeWine spent most of today's news conference addressing those disparities, then talked about what we need to do now.
To truly change things, we must address the social conditions that drive 70% of our health outcomes. Things such as healthcare access. Healthcare access, so very, very important. Education, so very important. As well as housing, transportation, employment, availability of nutritious food. Gathering and using data is key to understanding the problem, and it's also key to finding the solutions.
The governor started a minority strike task force last month, made up of 41 leaders across our state with ties to minority communities. They were tasked with helping to work towards a solution. In their preliminary report that should come out today, they recommend more pointed messaging about the pandemic geared directly to African Americans. They want more testing to be available in those communities, of course, access to those tests and a good healthcare option, and a collaboration between their agencies and others.
You cannot talk about messaging, testing, accessibility, or collaboration without dollars. So data drives dollars.
Ivanka Hall is the executive director of the Northeast Ohio Black Health Coalition. She's not on the strike force, but has been in touch with some of its members who she speaks of highly. She says DeWine's proposed budget cuts to education and Medicaid contradict today's message.
So unless he had an aha moment in the last, 48 hours when they released this report to him. But the things that he said 2 weeks ago ran contrary to anything that was said today. And so what I would hope is that today holds true.
We have an obligation to act. We have an obligation to do something. These truly are, when we're dealing with health, these truly are life and death issues.
Amanda Van Allen, News 5.